Pneumocystic pneumonia for medical student. Pneumocystic pneumonia is a severe fungal infection primarily affecting immunocompromised individuals. Pneumocystic gyrovesi is the causative agent, which was previously classified as pneumocystic carinii. This fungus is an opportunistic pathogen causing pneumonia in immunocompromised individuals. Pneumocystic pneumonia is most commonly associated with advanced HIV or AIDS. Immunosuppressive medications. The individual receiving immunosuppressive therapy such as corticosteroids or chemotherapy are at risk particularly. Those who have undergone the solid organ or stem cell transplantation are another risk factor for this pneumonia. Gradual onset of symptoms. It is insidious onset including fever, dry cough, shortness of breath. These are the main. Hypoxia. Progressive to severe respiratory distress with hypoxemia is a classical presentation for this pneumonia. Based on the symptoms and risk factor, it can be diagnosed clinically. The radiological findings include ground glass opacities and bilateral interstitial infiltrate on chest imaging. Definitive diagnosis often involves detecting pneumocystic DNA through PCR or identifying cyst in the respiratory specimen. Antifungal medications that includes trimethoprim sulfamethoxazole is the first line of choice for the treatment. In case of intolerance or contraindication to trimethoprim sulfamethoxazole, the alternative medication like pentamidine or atovaquone may be used. The high risk groups needs prophylaxis. So prophylaxis treatment is recommended for individuals at high risk such as those with low CD4 counts in HIV or AIDS. The trimethoprim sulfamethoxazole is the primary prophylactic agent, but alternatively may be considered based on the individual circumstances. Respiratory failure can be a complication. Severe cases can progress to respiratory failure necessitating mechanical ventilation. The relapse is another complication. Recurrent episodes may occur, especially if underlying immunosuppression persists. Immunization is the biggest preventive method. Maintaining immunocompromised patients' overall health and ensuring they receive proper vaccinations. Administering prophylactic medications to high risk individuals will also improve the preventive measures. Continuous monitoring for response to the treatment, potential complications, and relapse. For your board exams, the question could be as follows. 45-year-old woman presents to the clinic for a non-productive cough of 2 weeks. She has been feeling increasingly fatigued, weak, and had low-grade fevers. She reports that she also has shortness of breath with any physical exertion. She smokes 2 cigarettes a day. She has had 10 different sexual partners in the past month and does not use protective reliably. She has a past medical history of diabetes and reports something bad was found on her lab a year ago, but she never followed up as she had been feeling fine. On physical exam, she has diffused crackles in the lungs. Upon review of her chart, she had a positive HIV a year ago. She started on empirical antibiotics. So here the takeaway point is the immunosuppressed state, that is AIDS, and along with that the features like the symptoms like fever, the low grade fever, and feeling weak, fatigue, and especially the rapid breathing or the shortness of breath could be any one of those, and the different sexual partners, and then the x-rays or the radiological findings could be shown, and this could lead to you as pneumocystis pneumonia, and particularly they ask about the prophylaxis or the treatment, which is trimethoprim sulfamethoxazole. Thank you.